we please ask the Max Foundation and Novartis to come to stage, particularly Pat Garcia-Gonzalez of the Max Foundation and Dr. Lutz Hegemann of Novartis.
I'm Pat Garcia-Gonzalez. I'm the head of the Max Foundation. 34 years ago, we lost Max, my stepson, to a rare form of leukemia. He was 17 years old. So for the past 3 decades, the Max Foundation has been working to overcome the barriers and put the systems in place to be able to reach patients in every corner of the world and deliver cancer treatment. We have until now provided 600,000 years of life to more than 100,000 patients. Thank you. And as a result, our real time on treatment data shows that we have eradicated survival disparities for that leukemia that took Max. Today, if you're diagnosed with chronic myeloid leukemia in one of the 50 lowest income economies of the world, you can access the same treatment and you have the same chances of survival as somebody diagnosed in a high income country. And the key to our success is first a relentless focus on the patient and also in developing a human-centered health system strengthening approach that focuses on fixing the problems and eliminating the barriers around the patient to create a system that is sustainable for patients. And as we tackle breast cancer now and other high burden cancers, together with oncologists and hematologists in low and middle income countries, with global experts, with patient organizations, with ministries of health, and with the unwavering support of industry leaders such as Novartis. Today, we're proud to announce our 5-year commitment that will more than double our reach in the next 5 years. So we have helped 100,000 patients in the past 25 years, and our ambition is that by 2030, we will be reaching 100,000 patients every year. You know, if a few years ago, I met a young woman in El Salvador. Her name is Maria Caridad. She was 36 years old. She was really hardworking mother of 5. She was making pupusas at home and selling them on the street to support her children. And she had been diagnosed with cancer, and we were able to bring the medicine that she needed. And she said she will forever be grateful for the access to the medicine that was not only keeping her alive, but helping her continue to work and support her family. But she said the thing that really touched her heart was to learn that somebody in the other side of the world cared what happened to her. No one had ever cared what happened to her before. So today, I invite you to join us. Geography should not be destiny. All people should be able to face a disease such as cancer with dignity and with hope. Today, together, we can alleviate the suffering and prevent the premature death from cancer for so many. And because we can, we must, and we will for Max and for all those that left us too soon. Thank you so much.
Thank you, Pat, for your powerful words and for the extraordinary work that you and everyone at the Max Foundation do day in and day out. The more than 25 years you have dedicated to improving the lives of people living with cancer worldwide has inspired hope and dignity for patients. We are grateful for your transformative vision, unwavering commitment, and bold leadership. Ladies and gentlemen, at Novartis, we believe that access to innovative medicine should always reach the people who need them, regardless of geography or income. It is this very belief that has been the cornerstone of our partnership with the Max Foundation for nearly a quarter of a century, a collaboration that has to date enabled hundreds of thousands of patients in low and middle income countries to receive life-saving treatment. What began with the first patient in 2001 with the Glivec International Patient Assistance Program has evolved into something truly remarkable. We now provide access to 6 Novartis medicines across more than 70 countries. Together with the Max Foundation, we have reached over 100,000 people living with chronic myeloid leukemia, breast cancer, and other malignancies, but we are not stopping here. Today, I'm pleased that our partnership with the Max Foundation will continue for another 5 years, extending our commitment to the end of 2030. Through this next phase, we aim to reach significantly more patients, expanding not just our footprint, but shared promise of hope. This milestone reflects something deeper: Novartis' unwavering dedication to staying the course in global health, even in challenging times. But we cannot do it alone, and that's why we are delighted to have partners like the Max Foundation, and it is that these partnerships will stand the test of our time, even amidst profound change. I thank you very much.